Alrighty, good afternoon, everyone. You're truly getting ready for the weekend. Dr. Pierre here, board certified internist, founder of drpierresblog.com, author, speaker, podcaster as well of the Lunch and Learn, same name. This is episode 54 of the Lunch and Learn, and today we're talking about depression. And why are we talking about depression? Coincidentally speaking, today is actually National Depression Screening Day, right? Which is, it's sometimes I'm like shocked at how many different days and different things we celebrate, especially from a health standpoint. But the Lunch and Learn happened to fall on a day where it just happened to be National Depression Screening Day, so I figured might as well touch on that. If you want to, I do have a podcast episode on that. It's episode 12. So go to drpierresblog.com /LLP012, and you can listen to the podcast episode of depression. But I wanted to kind of still, because I definitely think it's a topic that still needs to be talked about. I don't think it's a topic that we should only wait on certain days to talk about it or certain times of the year to talk about depression. It's something that affects a lot of people in different ways and presents in a lot of different fashions. And because of that, I think it's especially as the holidays are about to approach, it's definitely something that we should always kind of give a refresher on. So again, today we're doing a refresher. So we won't do a podcast on depression next week. The podcast will be on a different topic, but at least I feel like talking about it on a day that happens to be Depression Screening Day, I think is very important, right? So I want to talk about, when we talk about depression screening, and this is definitely something that we tend to see, especially from an outpatient perspective, that I'll have a much better point to talk on. Do I see depression here in the inpatient setting? Sure, but for the most part, in general, a lot of this is an outpatient diagnosis, is an outpatient treatment course in that regard, right? So we're talking about depression from an outpatient perspective, right? What does that mean, right? I've talked about this previously, where as an outpatient physician, there's a lot of different reasons why you come to see the doctor, right? Sometimes it's for a regular checkup, sometimes it's for some headaches, upper respiratory infection, my nose is runny. But a lot of times, I've had quite a few patients come in for mental health, concerns, right? And when we talk about depression is one of the most common mental health disorders that we know of. It actually affects about, when I was doing some reading, about 15 to 16 million just Americans a year, right? And the reason why that number, we should really think about like how important that number is depression is one of the, especially most mental health in general, but in particular depression is one of those disorders that doesn't get diagnosed enough, right? So if you're telling me that 16 million get diagnosed and get treated for it every year here in the United States, that probably tells me that we probably have closer to maybe 20 million, right, of people who are depressed but never actually say something, right? So today we're going to be talking about depression. We're going to talk about some causes, some signs and symptoms, and overall treatment patterns. Again, you can always go back to the podcast episode, episode 12 of the Lunch and Learn, and we had a podcast episode where we talked about kind of getting to the bottom of depression. So as a primary care physician, one of the things that I'm tasked to do, especially when a patient walks into your office, right, is really to find out what's the problem with, right? Like, why is this patient in my office, right? And for a lot of times, again, which we said sometimes they come for very specific reasons, some joint pain, some back pain, my shoulder hurts, I have a runny nose, I have a cold, I'm getting a physical. Like there's a lot of times, there's a lot of different standout reasons that for sure this is why they came in to get it done. But sometimes, again, I've had patients come in for mental health, like, hey doc, I'm just not feeling well, right? I'm just not feeling myself, I'm feeling down, right? And so from a mental health standpoint, which a lot of times your primary care office sometimes become, right, especially when you earn the trust of your patients, a lot of times it takes a while, right? Again, for some of my patients, I was seeing my patients for months before they felt confident enough to come talk to me about their mental health issues, right? And particularly depression, right? Because depression is one of those things that from a social stigma standpoint, still isn't something that is favored. Again, you tell a person you have high blood pressure, you don't have to worry about any, ridicule, right? But if you tell someone you're depressed, right, you have to then worry about someone not believing you're depressed, right? Like, oh, how can you be depressed? Or how can, and perfect example, right? And I hate to call it, but like whenever, like a celebrity, right, or someone, maybe someone rich, whenever someone of a certain stature, right, commits an act like suicide, right, there's a huge contingent of people that can't wrap their mind, like, what do you mean, like, why would you commit suicide? You had everything going for you. You had money, you had cars, there's because a lot of people feel like that stigma of being depressed is something that's only associated with certain people, right? And that's something that I've always tried to instill in my patients so that they understand that it's normal. There's a lot of people who are depressed, right? And it's normal to feel the way you feel. And the important thing is, getting some help, right? Getting some help for how you're feeling is huge, right? Because, again, I talked about 16 million people. There's probably like 4 to 5, and I'm probably lowballing that, million people who need help and who aren't getting it, right? Because they're internalizing a lot of issues, right? So from a definition, right? So from a general medical definition, right? When we talk about depression, there's a time factor, and then there's certain characteristics associated with it, right? So from a time factor, depression is a state of feeling, loss of pleasure, feeling of guilt, feeling down, just a terrible affect mood on every single day, right? Every single day for at least 2 weeks, right? So again, if you're if you catch me, after, a Florida State loss, right, I'm depressed for like a day and then I'm back to normal, right? But if I had these certain feelings every single day for 2 weeks and they don't seem to be, you're classified as, depression, right? And there's a lot of different other types of depression. We'll kind of touch a little bit on the different types of depression and different ways you can be depressed, but that's usually when we talk about depression, especially in the general layman's terms, right? That's usually the setting, right? We're talking about in the setting of a person who's been feeling these, very ill symptoms every day, right? Daily, weakness, daily fatigue, daily loss of energy, daily loss of pleasure, daily feelings of like I'm just down and out, right? And every single day for at least 2 weeks, right? And you're classified as being depressed, right? Some of our causes, right? There's a lot of causes for it. Hormonal, biological. There's gender specific causes, right? There's genetic causes. There's medication causes for depression, right? There's seasonal causes, right? Time of the year, right? There's certain people who are depressed, during the winter, but okay during the summer, right? We talked about genetics. We talked about co-occurrence is a big one, right? So you can, and these are in particular for my patients who suffer from disorders that are chronic in nature, right? Especially chronic and in pain in nature, right? So I'm talking about my fibromyalgia patients, right? My rheumatoid patients, right? My osteoarthritis patients, but really bad osteoarthritis, like something that causes you to be in a constant state of discomfort, pain, and it just kind of puts you down, right? So that sometimes a lot of those people will have those diseases that they're dealing with, and then by the way, I'm also depressed because of it, right? So number one, we talked about biological or hormonal. Number two, gender is a big one. And the reason why gender is a big one because there is a higher propensity for depression to occur in women. But if you've been following me, since the beginning, I have a big issue with my men, right? Being like machismo, quote unquote, men, and they don't talk about their feelings, right? Men don't talk about their feelings. Actually, I think I have an episode. I'm almost sure I have a lunch episode on just men not talking about their feelings. And because they don't talk about their feelings, they don't own up to their feelings, right? Even though we diagnose women with a lot more. We diagnose women with depression a lot more. I think a lot of that is just from a biased standpoint of our men are not seeing their their doctor, right? They're not seeing their doctor in general, right? So, and usually when we do see them, I talked about it, 2 reasons. There's sexual dysfunction concerns, or some family member is like urging them, like, no, take your behind to the doctor like yesterday, right? Those are usually the 2 biggest reasons why I tend to see men in my office, right? Because again, we're very hard-headed when it comes to our health, so it takes a lot of push to get us going, right? So even though, yes, gender is a risk factor associated with depression, I think a lot of that is partially from a hormonal standpoint. There's a lot of hormonal variations in women than in men, and I think that attributes it more. But I think a lot of times from the men's standpoint, I just don't think they're being assessed as frequently as the women are. Women are more likely to seek help, or more likely to seek treatment and recognize when something's going on. And then we talked about situation. Situation was big, right? Divorce, financial issues, again, death in the family, right? So these are situation issues that may lead to feelings of depression, right? And if classically they last every day, they last for at least 2 weeks, bam, now you're depressed as well too, right? And again, even when you get the diagnosis of being depressed, it's not as if you stay depressed, right? You can get out of depression, right? So, and I think that's important to note, right? Because I think a lot of people think like, once I'm diagnosed with depression, right, then I'm always going to be depressed, right? No, that's not the case, right? Once I'm diagnosed with depression, you can not be depressed, after you're treated, right? That's not mutually exclusive, right? You can be situationally depressed and kind of have these waxing, waning moments, right? Hey, Amanda, thank you for joining. You can have these waxing and waning moments, right? So that's why it's important when we talk about depression, we understand that, especially in your patients, when you're explaining to them your concerns for depression, understand that, hey, the symptoms that you're kind of explaining to me now is concerning for depression, but that doesn't mean you're going to always stay depressed, right? So that's something that I talk to my patients a lot about, right? Like, yes, I understand you're experiencing some ills now, but understand that, exactly, circumstance. Understand that we can get you through it and then get you out of it. Hey, Dr. Jerry, thank you for joining. Thank you for joining the Lunch and Learn. So that's it, right? So that's like from a cause standpoint, and again, like I've always talked about situational bias. I think the bias is we're just diagnosing more women because we see them in office more. We see them in office more, so we're going to diagnose them more. And women are much more open to talking about their feelings than men are. So I think, again, 16 million is a great number. I think there's probably 4 to 5 million, and I think all of that 4 to 5 million is probably a lot more men who, for societal reasons, and we've talked about the societal reasons, just aren't going to fess up to their problem in that regard, right? And what I do, especially in the office, there's different questionnaires, and honestly, if you Google, you can Google depression screening, right? You're gonna see a lot of these depression screening tests, right? And actually, I have one here, right? Like I have this like it's like a nine questions that we tend to ask, and there's some that's like 4, there's some that are like 2, but it just varies as long as from a physician standpoint that you're asking the question, right? Because a lot of times, especially when we talk about mental health issues, a lot of times we're not even asking the question, right? We don't even ask. We just assume that this patient that I saw for the 3rd time in the last month, right, really has this vague pain that I don't know what's going on, right? And when we talk about the signs and symptoms of depression, right, that's one of them, right? Sometimes you can have these vague physical symptoms that, present themselves, right? They're real physical symptoms, like it's real pain, it's real stomach ache, it's real decrease, but like everything I do, every test I run does not, show up anything, right? And I remember in particular I had a patient who I'd seen in the office like multiple times in like almost like a 3 to 4 week span, right? And all of her symptoms were so vague, nothing seemed to really be pointing to any one direction, right? And then I finally asked her, I said, how is everything at home? Like, how's everything at home, right? Just, in general, because something's like was just off about her, and it just like floodgates, right? Like she was just waiting for someone to ask her, right? Because, and I think we do this very casually, especially when we see people on the show. Hey, how you doing? And for most people understand that you probably don't really care how they're doing, so they're like, oh, I'm fine, and then they just keep it moving, right? But like when you're in the doctor's office, right, and your doctor asks you, hey, how are you doing? No, really, like how are you doing? Like, how's life at home? It allows them to be so much more open. And again, this patient, she was just bawling tears, and then she told me everything, right? Tell me everything that was going on, right? She was dealing with a lot of situational causes for her depression, but she was definitely depressed because she had all of these physical symptoms, and I'm ordering blood tests, I'm getting imaging, and nothing's coming back, right? Like, I'm like, all right, like something's off, because like I think I know what I'm doing, right? And like I'm not getting the answer that I'm looking for, right? So those are some of this, and I think that's an important thing to think about, especially from a physical standpoint, right? You can have physical manifestations, right, of mental health issues, especially when we talk about depression, right? Depression is very big on that, right? It causes the back pain, the stomach aches, like all of these like pains and discomforts that you physically feel because you have like this mental, like mental block or mental like agony that's occurring at that time, right? So this questionnaire, right? So I'm just going to go run off these questions real quick for you, right? Have you had any little interest or pleasure in doing things? Feeling down or depressed? Trouble falling asleep? Trouble staying asleep? Sleeping too much? Feeling tired? Having little energy? Poor appetite? Overeating? Feeling bad about yourself? Feeling that you let yourself or your family down? Trouble concentrating on things, trouble reading, trouble watching TV, being very fidgety, moving slow, any thoughts of harm, right? And that's a big one, right? Thoughts of harm, right? And that's the 9 questions, right? And you, as a physician, you could literally just ask it. Sometimes some physicians will just hand the patient, a questionnaire like this. Say, hey, can you answer these questions for us, just so I can see? And it's very interesting to see how many of us kind of fall in, like, well, you know what, some days I do feel, but again, it's great at kind of weeding out, right? Like the situational, like, oh, wait, no, something happened, versus like, oh no, this is like a chronic problem, right? And we can tell that from tests like that. So when we talk about like today, right? Today is like National Depression Screening Day, right? And it's important, right? One, as a physician, right, to understand like there's a lot of different presentations of how a person may be depressed, right? And as we're going into the holiday season, right, again, we're talking about situational, right, where there's going to be a lot of like fanfare, there's going to be a lot of cheer, and there's going to be a lot of like happiness exuding all over the TV, right? But if you're in a state of mind, or you're not in the right sense, especially at a point of your life where you're like, nah, this sucks, right? Like, no, I hate the holidays, right? Like, if you're in that sense, right, this is when your depression symptoms can flare up. Right. So and then we talked about the different signs and symptoms again, pretty much, and a lot of it kind of follows those questions, right? A lot of that's good, man. Oh yeah, that's very important. There's a lot of different medications that can cause that can have depression as a side effect, right? And that plays into a factor of like the hormones, right? Because a lot of like medications that may affect hormone, may cause hormonal changes, can cause imbalances in your hormones that lead to you being more depressed, you having more depressive symptoms in that regards, right? So very, very true for medications to be a big cause. Not big, but definitely up there. Definitely something to think about when we're talking about depression, and we're talking about all of these signs and symptoms associated with depression. And the signs and symptoms, again, usually kind of follow along those questionnaires, right? Like, are you having trouble sleeping? Or are you sleeping too much, right? Sleep disturbances, right? Is there any appetite changes, right? Are you eating too much or eating too little? Concentration's a big one. The feeling of just feeling down and like like just feeling low and nothing seems to be picking you up. Even your normal activities that usually help pick you up don't pick you up. Again, these are all signs and symptoms and concerns, right? When we're talking about, depression in and of itself in that regards. And then the biggest one, which I think a lot of us, the thought, like the thoughts of wanting to hurt yourself, the thoughts of wanting to, commit suicide. Not even really. Again, we always talk about suicide, but even hurting yourself, right? Even like cutting yourself. Some people hit themselves, something to try to, again, sometimes as a form of punishment due to a perceived failure that they may have experienced. So there's definitely different ranges when we talk about hurting and wanting to hurt yourself, either emotionally or physically, right? And physically, the big one is always like the act of wanting to commit suicide in that regards. And that's something that you have to be very upfront with your patients, right? Like whenever I get a patient where I'm concerned that they may be depressed, I always make sure, like, that's a question, right? And you can't, as a physician, you can't really like sugarcoat it, right? You got to be like, hey, any thoughts of wanting to hurt yourself? Any thoughts of wanting to commit suicide? And you have to look your patients dead in the eye, right? You gotta let them know that, like, yes, I'm here for you, but I want to make sure you don't want to hurt yourself. Because again, you don't want to be that physician who saw the signs but didn't really act on it when you could have, right? That's not what you want, right? And you also don't want to be blinded by the fact that, oh, well, this patient is of a certain demeanor, or this patient's not going to want to hurt himself. No, you can't put that past anyone, and you can't put that past any age too, right? You can't put it past, whether they're young or old or even elderly. That's something to think about. That's always something to be concerned about. Wanting to hurt yourself, because you want to be there. You want to be there, and you want to be able to kind of treat it, right? Because when we talk about treatment of depression, right, we talk about treatment of depression, the first big thing is you got to acknowledge it, right? So if I can't even get you to the point where we acknowledge, yes, I have depression. If I can't get you to that point right there, there's no point to even think about treatment options, right? There's no point at all, because again, if you can't get a person to accept that they have depression or they are depressed, then whatever treatment options is usually not going to work. Because we have two arms, and then we could talk about treatment. We could talk about medications, and there's a slew of medications for depression, right? And therapy, right? Which I'm a big proponent of, right? Mental health, I'm all about mental health, right? So therapy is a big one, right? And there's been studies that talked about, what about, is therapy alone is good enough? Is medication alone good enough? And we've kind of seen that sometimes a combination of the two seems to work very well for your patients, right? So you have your medications. Again, there's a slew of them. You've seen thousands of commercials on them. Celexa, Paxil, Zoloft, all of these. There's a slew of medications, and they all come with their risks as well. They all come with their side effects as well. And there's therapy, right? And when we talk about therapy, there's individual therapy, there's group therapy, there's virtual therapy, right? Again, we're getting to the point now, my wife actually does it, where you don't even have to be face to face or even in the same room as your therapist, right? There's lots of different ways to seek treatment, right? But we just gotta get you to the point to seek it, right? So again, that's why I have no problem with a day National Depression Screening Day, because hey, I think it's always good to always bring up the fact hey, there is help, there is assistance, but I got to get you to the point where, one, as a physician, and I think especially a day like Depression Screening Day, that's more on the onus of the physician, right? Or the health professional, right? Whoever it is. And that's them saying yes, you have an issue, or I'm concerned that you have an issue, and we got we got all of these testing out here. There's a whole bunch of them online as well. That I just want to see kind of where you fit in, right? But even when you see this, right, even let's say you answer all of the grade, right? You answer all of the grade of the questions, you still need to follow up, right? Because especially those who I know we're at a point in time, especially when it comes to medicine, that a lot of stuff gets done electronically, right? So a lot of your friends and family, they may just go online and say, oh, let me just the depression screen, let me see if I'm depressed, right? And that's only part of it, right? But again, a lot of the times, when we talked about the situation, or we talked about different causes, right? That's why it's so important, right, to be able to kind of put these two together, right? This is only like a tool, right? If I have patients, I don't need this tool to show me you're depressed, right? Like everything you're telling me, everything you're showing me says you're depressed, right? Like this is more of a confirmation, right? So when you think about these tests, especially any type of these online health tests that you see, think about these are more of confirmation for something that the professional already is thinking about, right? It's not really like, oh no, this test said I'm depressed or I'm not depressed, and I'm just gonna go by that. I don't need to see anybody else, right? So always, like we do with all of these, these lunch and learns, follow up with your doctor. Especially as well as you should be following with your doctor anyways, but follow up with your doctor and say, hey, you know what, I took this test online, I answered it this way, what do you think about it? And then kind of come to some game plan of action with your doctor or your therapist or whoever you tend to see in that regard, right? And again, as always, I think to get to the point where we're even having a depression screening, right? Like we got to accept that, there may be an issue for depression, right? And I'm definitely talking to my men, right? Because I think the men, unfortunately, because of a lot of social stigma that's placed on them, they face so many different pressures, right? Not to exhibit signs of being emotional, right? That they repress, right? And so your men, right? So again, even I talked about, difficulty sleeping and, overeating or feeling down, right? For example, like a questionnaire like this, I'm not even really going to ask my men most of those questions, right? Because they're going to know me anyways, right? For men tend to exhibit symptoms of, anger. They tend to exhibit, very short fuse. They tend to be a lot more violent, especially when they're depressed, because again, they don't really know, they haven't been taught how to, express their emotions any other way, right? So it's usually a lot of anger and a lot of withdrawal. They're very withdrawn. They don't want nothing to do with it. They don't want any acknowledgement of what may be going on, because again, for them, even going in this direction where you're starting to say, hey, I think I may be having a problem, right? In their back of their mind, and sometimes, even outwardly, there's that social stigma that is so great that they don't want to be like those guys, right? Like, no, I don't want to be considered, quote unquote, less of a man, right? If I say I am sad, I don't want to feel like I'm less of a man if I say I'm depressed or I'm anxious or all of these other things here, right? So they just totally will try to bypass it, right? So even though you got these questionnaires, right, I can tell you right now, most of these questionnaires not going to be very good for men, right? Especially the type of men who, I'm used to seeing in my office, right, where they're so much cheese mode out, right? Like them, and I can tell you, I've had patients, and we'll end it today with a good patient case, especially from the male perspective, right? Had a patient here, right, and he was dealing with. I would say his was more of a co-occurrence type of depression, because he had a lot of medical issues, right? And he's always been dealing with a lot of medical issues, right? And it got to the point where those medical issues were then affecting the home, affecting, financial circumstances, and all of these things are kind of was snowballing. And I would see him again almost like every couple of weeks, right? For just vague this, vague that. And he would always right when we were about to end the appointment, right? Always just kind of hey doc, man, I'm so tired. Like, he would just kind of go in like a good 5-minute tirade of what he was upset and tired about, right? And every time he would do that, I would say, hey, you know what? I'm getting kind of concerned, because you're definitely. I don't want to say it, right? Especially because my men, I always have to you should cry, right? We're so babies with it. You have to kind of spoon feed it, right? I was like, I'm concerned that maybe having some issues with depression or something, right? And of course they automatically withdraw, right? He's like, no, that's not me. And that happens all the time, because that's what they do. So he's automatically withdrawn. So, all right, sure. So I see him in a couple weeks again for another vague issue, and right at the end of the appointment, boom, another 5-minute tirade again. So again, I reintroduce it, say, hey, a lot of the things that you're telling me, I'm concerned. Not saying you have it, but I am concerned there may be some depression kind of going along with it, right? And honestly, it took me about 4 appointments, like literally, like I remember, it took me like 4 appointments just for him to finally say, you know what, doc, I think I'm depressed, right? And like he had to say it, right? Like, because it was very obvious that he was not, like I was not the one who was ever going to be able to say, I think you're depressed, right? Like it was very obvious, right? Like if I did not get him to the point where he thought he was depressed, right, we weren't going anywhere, right? And that's unfortunate. Unfortunate for a lot of men, because like that's usually how it has to be approached, right? Like you have to almost like, bring us all the way to the well, right? And then we start drinking, right? Because if I just tell you like, hey, I think it's over there, you're gonna get lost. You're not gonna go in that direction anyway. You're gonna be defiant, right? But if I just keep bringing you along, and keep in planning, hey, you know what? I'm concerned about depression. We don't have to do anything. I'm just concerned about it. I just want you to think about it. Like, until the 4th appointment, when he finally, I guess it got to the point where there was really no reasons for him to come to see me. He was literally just coming to see me just to talk about his depression, right? Just to talk about his concerns, his feelings, his trouble sleeping, all these other things that, again, in the beginning, I would have told you right from the first appointment, like, yeah, I'm concerned you got depression. But because he was a man, he wouldn't come to it, right? And that's what happens a lot, right, for our men, right? So National Screening Day, again, I think it's important. It's important to like start like looking at some of your family members, thinking about some of your family members who may be exhibiting certain signs and symptoms, and I'll put a link to this diagnostic testing for depression, just so you can kind of get an idea of when we talk about depression. What are some things that we should be looking out for? And I'll put a link to the podcast as well. Like I said, episode 12, we already talked about depression, so you don't have to worry about a podcast on depression because we already talked about it. But I felt it was just such an important mental health disease, again, one of the most common ones out there. It was such an important one that you got to talk about it, right? You almost can't like just say, oh, we already talked about that, we don't need to talk about it again. Because you'll see, especially those who've been, again, we're on episode 54, right? So for those who've been rocking with me, you'll see a lot of our topics will just continue to keep coming up because, they're just not getting better. We're going to talk about heart disease because heart disease is still heart disease. Whether I talk about it in 2016, 2017, 2020, still going to be heart disease, right? And you're still going to need to know it in that regard. So, I'm not going to keep you long, and I don't like to keep you guys too long for these lunch and learns, but this is episode 54. Dr. Pierre here, founder of drpierresblog.com. Don't forget to subscribe to the podcast if you have not subscribed to the podcast yet. You can join I have a Facebook like messenger list so that whenever I do these things, I can make sure that you get a quick little message out there so you don't even have to think like, oh my God, I missed Dr. Barry's lunch and learn. And I'll put a link to how to get to my Facebook messenger list as well, so everybody be up to date on what's going on with yours truly. So I'm gonna see you guys later. Hope you guys have a great weekend. See you next week. Bye.